everyone. Welcome and a very happy International Women's Day. We are elated to be hosting this health talk for all the wonderful women. Today's discussion revolves around the health issues women go through in the current times, and the experts on the Vital Healing Team panel will give us insights about how to effectively deal with them. A warm welcome to all the accomplished women sitting with us. Dr. Preeti, a gynecologist joining us from Singapore. Dr. Shweta, a homeopathic physician from Ireland. Dr. Monika, again a homeopathic physician and a counseling psychologist from Nagpur. Myself, Pragati, a nutritionist based in Mumbai. So to begin with, I would request Dr. Shweta to highlight what are the basic health issues women face and what are the major concerns of women considering the current times. Dr. Shweta.
Yeah, thank you so much, Pragati, for the lovely introduction. And yes, to begin with, it's not just the women. Let's also include the young girls. So there are few things which we really need to mention and have to pay attention on. Starting from the age of puberty, when the physical changes, they start to adapt. The new physical changes and even emotional changes, and then young girl, due to cyclic process, they fall prey of anemia. And then there are quick relationship issues also, and early onset of sexual activity and things going on. Then understanding pregnancy, antenatal and postnatal care, and sustaining of a pregnancy well, that also is a issue women face. Then conception disorders, which are very, very common these days, say it infertility or wanting to choose the pregnancy, wanting to choose to be pregnant a bit late. So the conception difficulties arise, and frequent miscarriages, abortions, various kinds of hormonal disorders like PCOS, and metabolic disorders, diabetes, thyroid. Then the pressure and the stress related to bringing the balance between the family needs and their own aspiration and work-life balance, handling issues with the partner, sometimes office abuse or workplace abuse or home abuse, which used to be before, but now the situations have changed, and the abuse and violence is of different kinds. Not all face it, but yes, it's not gone from the society. And then in advanced ages, if we say, there are various issues like menopause and handling it well, and osteoporosis, osteoarthritis. Then as I already mentioned, diabetes, and then cancers, they are super hot and burning topic these days, and heart diseases. So these are all usually women issue which they go through in the life at different ages. And here I would like to ask Dr. Preeti Dutta to give few insights on a very, very important topic which girls and young adults face in conception and in infertility, and what are the causes and how to treat them, how to address them, what are the tests they can go through. So Dr. Preeti, can you tell us more on this?
Sure. Thank you, Shweta, for a very comprehensive introduction. And once again, I wish a happy International Women's Day to all the panelists and all our viewers. And once again, I thank you for this wonderful opportunity to be part of this webinar to discuss topics which are pertinent to all women. So so now first we discuss the difficulty or in getting
pregnancy.
So growing infertility. So first I would like to tell every woman, please don't have this guilt or don't take this blame that you are unable to conceive. Your male partner is 50% responsible for infertility among couple. So hence, we always start our investigations with the male partner, including his semen analysis. So don't take that blame or guilt that you are not able to conceive and you have some problem within yourself. So among the causes of rising infertility, here I would like to share that age of woman is very important. Number of eggs gradually decline with age, especially in mid-30s, and they drop rapidly after the age of 35, 38. Smoking, stress, increasing consumption of alcohol among women, weight issues, either overweight or underweight, hormonal issues like PCOD, diabetes, thyroid, other gynecological problems like ovarian cyst, polyp, fibroid, all these issues with the rising age of marriage and conceptions causes infertility among couples. So what can we do? So among all, there are various tests. As I mentioned, we start investigations with the male partner with the semen analysis. So tests are usually among female, the tests are usually to check the ova and the tubal patency. These are the basic tests. So for to check the ova, we do ovarian reserve test, which is a combination of few hormone blood test and the vaginal ultrasound. So the value we look forward to is more than 1 nanogram per ml is considered as a good predictor, a good number of oocytes. But remember, this is a quantitative test, not the qualitative. मतलब ये हमें नंबर बता रहा है कि आपके number of eggs are good, but how good are they for conception, it does not tell us. So even if this test has its own limitation, please understand that. And this test is usually done in the first follicular stage, which is usually on day 3 of your cycle, between day 1 to day 5. These are the tests to check your eggs, and other tubal patency tests are done. Some are radiological tests, some are laparoscopic tests. So, and what I can suggest to improve your fertility, stay away from smoking. Young girls, please. Smoking permanently kills your eggs. Manage your stress. Understand, nowadays, we all are juggling with many, many responsibilities at your home, at your workplace, with children. So please manage your stress. It becomes a vicious cycle. Okay, to have this stress that this cycle you should conceive, please come out of it. Give yourself ease, and it affects your chances of conception. So manage your stress properly with meditation, with exercises and all. Eat healthy. Invest in your supplements, folic acid. Manage ideal body weight with diet and exercise. At the most, we can suggest to freeze egg for extreme cases. So these are usual tips I will suggest our young women who are trying to conceive to improve your chances of fertility. And treatment, it depends after the holistic investigations, what are the cause that is pertinent to the cause of infertility. This includes ovulation, usual ones, ovulation induction, assisted reproductive technology, ICSI is very common. So that depends, this medical treatment depends on the real cause after thorough investigations. So Shweta,
Yes.
coming back to you, can you give us some homeopathic of infertility and hormonal imbalance, specifically diabetes and thyroid, which are very common among young girls?
Yes. Thank you, Dr. Preeti. So well mentioned by you about fertility. The main cause now when the women are choosing to get pregnant a bit late, that is major. And other factors, as you already mentioned, and I would like to add a few. The fallopian tube damages or blocked fallopian tubes and PID, and sometimes abnormality with uterus or cervix, probably fibroids or stenosis. Rarest times in young adults, endometriosis and primary ovarian sufficiencies. I would like to add these causes as well. Coming back to PCOS, which is very, very common these days, and females present with this so much, and not only for conception but for usual cyclic periods also. They are always running into irregular, infrequent menses, prolonged menses, and hirsutism, which is a problem with high androgens, and the body hair grows a bit more manly, sort of male pattern baldness is there. They face the problems of acne and ovarian cyst. So these cysts are not harmful in their own, but they usually give you another and more hormonal imbalances. And the causes of PCOS are obviously, as you mentioned, infertility is the outcome also. And the causes, if we can say, insulin resistance is the biggest cause. What happens in insulin resistance is the body cells become less sensitive to insulin, so the body has to produce a bit more insulin, and the pancreas go in pressure. And then there are lifestyle and factors which are very important. Refined carbs. So refined carbs, taking refined carbs is very important. I think Pragati will be good to talk about this more. But then refined carbs, chronic stress, genetic and environmental factors, EDCs, which are endocrinal disrupting chemicals, other toxins. So they all together, they all contribute into PCOS and these hormonal disorders. And then coming to thyroid, which is very common in hypothyroidism, is quite common, where TSH level is elevated because thyroid hormone produces less thyroid. So TSH you will find more, and T3 T4 less. And the symptoms which you will find will be fatigue, cold intolerance, dry skin, and hair loss. On the opposite end, hyperthyroidism, where TSH is decreased and T3 T4 are elevated, and the symptoms will be weight loss, rapid heartbeat, anxiety, and heat intolerance. And other thyroid disorder, probably the thyroid nodules, which are usually not cancerous, but they are lumps, but they're not good. So for the diabetes, the main thing was insulin resistance only, and then the glucose level in the body rises. It is a state of actually the overnutrition. So it's, as Dr. Preeti mentioned, it's a vicious cycle. If it starts, say from suppose in a sedentary lifestyle, lack of physical activity, then the body weight increases, then the obesity increases, BMI goes for a toss, insulin resistance increases, other risk of metabolic disorders, diabetes type 2, hormonal imbalances come into play. Then it contributes to further insulin resistance and high blood pressure, cholesterol, liver disorders, cardiovascular disorders, and chronic inflammation set in, which gives rise to again these disorders and even chronicity of these disorders. So these are the things which are very important to understand, that you have to break that cycle from somewhere, and it's very good to start from the starting point, that have an active lifestyle. And coming on to the homeopathic point of view, so we have quite a targeted approach which focuses on the cause and the individuality of this person in specific, not just taking note of the symptoms, but also mental makeup and physical makeup in totality. So we choose few medications which are helpful, and here we suggest that whenever you are facing any problem, you try to reach to us a bit early, rather than just taking a toll on your health and just letting it go. Just be there to contact to a physician as early as possible. So here I would like to ask Dr. Monika to give insights on the role of stress, which is very, very important for all these issues: thyroid issues, hormonal issues, infertility, diabetes. Can you please give us good insight that how stress is related? Dr. Monika.
Thank you so much, Dr. Shweta, to talk on the topic which is very close to my heart.
Yeah.
So, mental health. Mental health is very important because this is the thing which patient or client can experience at initial level, which is not visible at physical plane initially. So this is very important. When you experience something inside, it is very difficult to treat with even. So mental stress is the starting point of the mental stress is at that level, that we have to like touch to one to one. We have to treat our client at one to one level. Now, how this stress is causing the things is like that. When as a woman, as a female, no doubt whether she is working or non-working, she is always in a multiple role. She has to play a multiple role. She is in a multitasking, always in a multitasking seat, always. So at that time, that constant stress is in her mind. That stress leads to the imbalance in the cortisol and adrenal level, and that fluctuations will lead to high in the sugar level. I'm not saying that stress is causing the diabetes or thyroid, but at the same level, it is creating a favorable situation for such kind of diseases. Or we can say, if I'm even more in the logical mind, then it causes psychosomatic illness. When your mental thoughts, your mental illness is creating physical symptoms, you'll end up into anxiety and depression. So see how the cycle runs. And once you are entered into hormonal imbalance situation, you let up like that, don't want to do anything. Now, how is your fertility is affected? See how your body is so beautiful. Your body always gives you an alarm that
Signals.
please take care of me. But see how we sometimes we females neglect this. So how this happens? Like if you are like your when your hormones get imbalanced because of rise in the sugar, your hormones are getting down, serotonin level affected, adrenal level are affected. You don't want to do something, you don't want to do exercise, you do not want to do any physical activity, even you are not in a situation to having a healthy diet. So these have led to your decreasing in the fertility level. See, because exercise and your daily routine, your eating habit, remaining happy and positive affects your fertility, affects your ovulation. It has certain it's definitely affects. So see how beautifully your mental health status is governing your body. First your mental health is affected, then it imposing symptoms on your physical state. And how it is affecting in infertility level. Now I talk about how it affects in a healthy state, how it affects in your fertility period. Now how it affects in your infertility stage. In infertility stage, when you are in stress, or I'm not able to coping it with the situation, I'm not able to conceive, what is the problem? So that stress is again what people will say, why this is happening with me. So this again affects your hormones.
True.
And it's again hindering in the further procedures given by the experts. So this is how the cycle runs. Now, I would like Ms. Pragati to please throw some light on how nutrition can be beneficial in this aspect.
Yes, surely. And thank you, Dr. Monika, so much for so beautifully putting it out there, how stress is affecting us. I would like to add that a few but significant dietary changes can go a long way in improving our reproductive health. So a few basic guidelines that both men and women should follow would be minimizing the intake of refined sugar, refined carbohydrates, refined oils, and consuming more of complex carbs like whole grains, oats, quinoa, jowar, bajra, millets which are so popular these days. Incorporate them in your diet. Vegetables like sweet potatoes, apple, pear, bananas, all of these stabilize the blood sugar levels. They promote satiety and they provide sustained energy throughout your day. So this will take care of your glucose levels and eventually it will help you in saving yourself against diabetes and high blood sugar levels. Apart from good carbs, include good fats, nuts and seeds, flax seeds, chia seeds, other nuts like almonds, cashews, sunflower seeds, or in fact, simple coconut. The humble coconut, include it in all forms, but get good fats in your diet because good fats are primarily responsible for production of hormones in the body. Now, it not only produce hormones, but also regulate hormones, which again helps in conception and healthy pregnancy. Similarly, our protein intake. It is so important for everyone to include good protein in the diet. It is good for hormonal balance. It is good for hormone productions. Uh, when there is fat loss because of good protein, it improves our insulin sensitivity. It then helps with thyroid situations as well by stabilizing the blood sugar. Now, the protein is actually made up of different kind of amino acids. So 20 of them which are found in the body and 9 which have to come from outside food resources. So it is very important that you include different sources of foods which have different amino acids. I'll talk about the 9 essential amino acids which are present in certain foods. Very simple things like buckwheat, हमारा कुट्टू का आटा, अमरंथ आटा, राजगीरा जिसको हम बोलते हैं, hemp
Which we
seeds,
always
chia.
used to eat in fasting.
Yes, exactly.
Indian,
So it's
Indian
time to bring
perspectives.
those foods back in our diet because they are actually nourishing foods. They're nourishing us, the body, the soul. Some common foods these days are tofu and tempeh. They are good sources of protein.
Can you
So,
explain, Pragati, what is tempeh? It is so much in
oh yeah,
talk of the
definitely.
town kind.
Yes, exactly. It's out there. And it's actually a very good source of protein. So this is nothing but fermented soya bean.
Okay.
Yeah. So if you're not able to source it from outside, what you can simply do is you can boil the soya beans at home and get live cultures, which are readily available at medical stores and other markets, which are these live cultures are called koji or rhizopus mold. These are certain names, and you can just prepare your own tempeh at home.
Okay.
So these are some basic things: the carbs, proteins, and fats, which you should be taking care of. But you must never forget that the most vital nutrients are the micronutrients. So things like vitamin D, B12, zinc, magnesium, omega-3 fatty acids, iodine, all these, they help you boost your immune system. They then correct the hormones and regulate your menstrual cycle. When your menstrual cycle,
Pragati, can you please explain or not explain, just tell us quickly about there are any so if there are any
yes,
sources of
yes, yes.
vitamin B12 in vegetarian diet also?
Vitamin B12. Yes, vitamin B12 is available. Let me share something with you all. So here are some essential nutrients which will support healthy pregnancy. So when we talk about vitamin B12, it is found in meat, fish, eggs, which are the non-vegetarian sources. But apart from that, cheese, nutritional yeast, and dairy products, it is also found abundantly in those two. So include them in your diet. Apart from that, folic acid, as Dr. Preeti mentioned, we should be starting supplementing folic acid just when you are actively trying to conceive. It will
True.
be very helpful that you do it. Similarly, please take care of your iron, calcium levels, iodine, which is very important to rule out any thyroid disorders. Vitamin D is very important for absorption of calcium. All these are going to just regulate your hormones, making it easier for you to conceive. Uh, and in the long run, not just the reproductive age, but in elderly age, these are going to help us fighting against, menopause and other old age related problems, which I would like Ms. Dr. Preeti to please throw some light on it.
Thank you, Pragati, giving a wonderful and succinct insight about the nutrition. Not only during pregnancy, that you should make it your lifestyle. So now so far we were discussing the middle age group, the reproductive age group. Now we are discussing problems during menopause. So with the changing life expectancy, with the increasing average woman age, 1/3 of their life they spend after menopause. So we really need to take care of ourselves during this period. And there are a lot of changes goes through the women's body during this period. After that, the most important is slow decline in estrogen hormone. This starts not only after menopause, it starts during the perimenopausal, which is period बंद होने से पहले से ही ये process start हो जाता है. So decrease in estrogen causes osteoporosis, and it is said that 1 in 10 women go through osteoporosis, and you can lose up to 20% of your bone mass. Of course, because of lack of estrogen after menopause, women are much more prone to osteoporosis than men. So here we can discuss what we can do to protect ourselves from osteoporosis. Again, a healthy lifestyle. Exercise, make it, your religion.
Yeah, true.
Yes. So exercise, establish a regular exercise program for yourself. Weight bearing exercises like walking, jogging, cycling, stair climbing, even yoga. All these things helps in increasing your bone strength.
True.
As Pragati has mentioned, food which are rich in calcium, which helps in the strengthening your bone. Definitely, when you are taking calcium, you need to take care of vitamin D. So easily available. It is sunshine. Like sunlight is the most important and free source of vitamin D. But I believe most of us who remains indoor most of the time, they are all deficient in vitamin D, which leads to your body aches, here, there in the body. Other than that, there are medications which we can take, like biphosphonates are very popular these days. Some specific, these are specific estrogen receptor modifier medicines. The most common ones are tamoxifen, raloxifene, menopausal hormonal therapies. But all these things you should take with the consultation of your doctor. So during this phase, you really have to take care of your diet and exercise. That is definitely going to solve most of your problem, other than going for medical treatment afterwards. So Pragati, I request you to give more insight about the diet and about the nutrition during this menopause, and to tackle age-related issues during this phase. Sorry, I just would like to share to detect how you detect that you are developing osteoporosis.
Yeah.
So there are some tests to detect. These are simple X-rays, like to do bone marrow density. These are like DEXA scan. So we do for some women like over 65 years of age who are having more risk factors to osteoporosis, who are more prone to fractures. So these are simple X-ray tests for the spine and the hip bones where you can detect osteoporosis. So these are simple tests, so nothing to be afraid of. And to treat, as I mentioned, your lifestyle and good diet rich in calcium and vitamin D will help you a lot. So Pragati, I request you kindly elaborate further on the nutrition requirement for the woman at this age to manage their osteoporosis and age-related issues. Thank you.
Yes, absolutely, absolutely. Thank you so much, Dr. Preeti, again. So as you've rightly mentioned, that we need everyday exposure to sunlight to maintain our optimum level of vitamin D. Vitamin D is very essential when it comes to calcium absorption, and certain calcium rich foods in the vegetarian diet are like yogurt, almonds, flax seeds, chia seeds, green leafy vegetables, chickpeas, tofu, soybeans. These are all very rich in calcium, and you can supplement vitamin D3 for it to be absorbed. For vitamin D3, apart from the sunshine, as we've spoken about, another options are eggs, fresh cheese. In some places, there are certain varieties of mushrooms such as portobello and shiitake. Uh, these are good sources of vitamin D3, which we can easily include in our diet. Also, I would also like to emphasize on the everyday, the exercise routine that we all women should have to develop healthy bone mass. So yes, these are my take on dealing with menopause and osteoporosis.
Okay.
I would like Dr. Monika now, if you can suggest us something more.
Yeah. So yes, regarding menopausal phase, see how again how hormones affecting in menopausal phase, affecting the post-menopausal phase, are estrogen and progesterone drop down and is directly related to your health. To throw more light on this topic, I would like to Dr. Shweta to talk upon this.
And yeah, okay, I can discuss especially the homeopathic aspect to it and a bit more related. So right from the age of not the actual menopause has set in, but just before, due to all these hormonal imbalances and everything, many women come to us with the problems like headache, fatigue, migraine, falling of hairs, thinning of hairs, acne, rashes, loss of libido, and then breast changes, and sleep distresses, and so many. From there, when they advance into menopausal state, so they are actually the bunch of emotions only and struggling with their hormones and hot flushes and whatnot. So it becomes very important for us to take note of what is going in their psyche. The mental part we play too much attention on, because we have to see what is causing, and also if there is any cause of lack of physical activity and anything sleeplessness. So that is our main concern, and according to that we decide on the medications. If I talk about the medicines, there are various medicines in homeopathy. If I like to add few names like graphitis and sepia, natrimur, even pulsatilla for especially younger ages, but then even many arsenic and so on. But the main focus, and here also, as for the osteoporotic changes, we also supplement with the calcarea phos and other biochemic medicines to make them nutritionally supple as well. But yeah, the main fact lies that we pay too much attention on the physical also and the mental makeup also, to reach on a conclusion that what medication has to be given. And it's very important to note again that as soon as you come to us, as soon as will be your problem sorted. If you come with this intention that जैसे कि बोलते हैं उसे टालना, अपनी डिजीज को टालना और फिर कुछ इंपॉर्टेंट या कुछ मेजर क्रिएट कर लेना एंड देन रीचिंग आउट टू अ डॉक्टर, सो दैट इज नॉट गुड. और एक चीज और है जो मैं यहाँ कहना चाहूंगी कि स्पेशली मीनोपॉज और उस एज में जो बहुत ही चीजें देखने को मिलती है, और खासकर कैंसर्स. सो ये बहुत ही इम्पोर्टेंट टॉपिक हो गया है, एंड आई वुड like Dr. Preeti to start this, that how is such a higher incidence of cancer is there. If we talk about cervical cancers, if we talk about breast cancer, which is number one when we talk about female health, especially related to this age group, like when you reach 40, 45, sometimes it's start early on, but most of the women. So Dr. Preeti, would you throw light why it is happening and what are the tests we can go through? Can you please? Yeah.
Sure. Thank you, Shweta. Yeah, cancer, as really a burning topic for everybody nowadays. And our investigations are to, even for simple cases, are first surrounding to exclude cancers. So this is अभी कैंसर, पहले जैसे कहते थे कि कैंसर बुढ़ापे में होता है, बड़े उम्र के लोगों को होता है, but no, nowadays we find the changing patterns. Young girls, even in the teenagers, reproductive age group, they are also very vulnerable to cancers. They come for that some other problems and they are diagnosed with cancers.
Right.
So early diagnosis is very crucial in terms of successful treatment and life expectancy. So for early detection, cancer screening is very important. It is basically to help us to look into abnormal tissues which are precancerous or potentially cancerous, for having an effective treatment, and so that your quality of life is not compromised. So women are more prone to breast cancer, cervical cancer, and colorectal cancers are very common among women. So first I would like to take breast cancer. So unfortunately, there is no known cause for any these cancer. So, but many women have some risk factor, but these cases are sporadic. Some of them come with known risk factors, but it is good to know if you are having these risk factors, you are more prone, so you should be more careful and go for regular screening. So among the risk factor, very important is family history. If your mom, aunts, anybody in your family, masi, nani, dadi, anybody had breast cancer, whether diagnosed or undiagnosed, is very, very important factor. So family history, early age of menstruation, late menopause, not having child, not having a baby, not breastfeeding, weight gain, especially after the menopause, more excessive intake of alcohol. So these are the common risk factors for women to have cancer. So coming to sign and symptoms comes at very late stage. Don't wait for that.
Right.
By the time you will see some signs or some symptoms, things will be very advanced. So the common sign and symptoms are any abnormal lump in the breast. Don't ignore any lump in your breast. Seek medical attention promptly. Get yourself examined by a specialist and do the follow-up as necessary and as advised by the doctor. So any lump, change in the size or shape of the breast, change in the color, any discharge from the nipple, or any changes in the skin, rash, any retracted nipples, any discharge, pus-like, even plain watery discharge from nipples, any abnormal discharge, please seek medical attention promptly. So when it comes to screening, a self-examination every month in the beginning of cycle, a systemic examination, there is a thorough, is a proper way to do a self-examination.
Self-breast examination?
Self-breast examination every month. If you do it in a systemic manner, you will be able to, if you find any abnormality, please seek immediate attention. The lump can be in a younger age group, can be a benign lump. It can be just like a fibroid myoma or some benign lump, but there is a chance it can be cancerous, so don't ignore it. Please seek attention. Doctor will do the necessary follow-up and may take a FNAC, just like they put a needle and take some tissue from it to diagnose it, or can do a biopsy. So don't ignore any abnormal lump or discharge from breast. Mammogram is a very cost-effective tool. I suggest every woman should go for mammogram. So in the age group of 40 to 50, you can go for mammogram every year. After the age of 50, you can go for mammogram every 2 years. It's a very cost-effective, simple procedure. It is just an X-ray, and it is very beneficial. If on mammograms, doctors see any abnormal tissue, abnormal area in your mammogram picture, they can advise you for biopsy. Don't be disheartened. Don't get panic. Follow the advice and go through the process. Early detection is very, very important for successful treatment.
True.
So now coming to cervical cancer. As I mentioned, though the peak age group is the middle age group 40 to 50, but it is very common now even in the younger age group. Fortunately, this has a HPV virus. The variant 16 and 18 are known for causing 70% of the cervical cancer. So though, as I mentioned, for the breast cancer, there can be other risk factors as well, just like having unprotected intercourse, multiple partners, and other HIV, other immune deficiency diseases. So these are the risk factors which can cause cervical cancer. Now it is a highly preventable and curable cancer if detected early. So don't get panic. And so coming to sign and symptoms of cervical cancer, any abnormal bleeding, don't ignore it, considering it ऐसा तो होता ही है, प्रेगनेंसी के बाद ऐसा होता है, पीरियड्स बंद होने के टाइम ऐसा होता है, लेकिन it is very, very important you go to doctor, get a thorough checkup done, get a pap smear done. It is a very simple procedure. Don't be ashamed, don't ignore yourself. So any abnormal bleeding, any abnormal vaginal discharge, any contact bleeding, which we call postcoital, after having sex you have bleeding, any dysuria, any lower abdominal pain, heaviness, don't ignore. So when you have these kind of things, please go and see your doctor soonest. The good part is if this cancer is detected early, the results are very good. It is a curable cancer. So as I mentioned, the purpose of this screening is to detect precancerous cells. So when they take the pap smear, they scrape the cells from the surface of the cervix and examine it. So if there are any precancerous or potentially cancerous cells found in the pap smears, doctors may advise you to take the biopsy from the suspicious areas. So you can, ideally, every woman should go for pap smear test, and it is a test you can do it every 3 years. So, and you can combine the pap smear with HPV testing, which is the blood test, HPV testing every 5 yearly. So a combination of pap smear 3 yearly and HPV testing 5 yearly has a high rate of detection of cervical cancer at an early stage. Good part in this case is for young girls between the age of 10 to 25 can take HPV vaccine is available. So discuss this thing with your doctor. They can advise you if you are appropriate candidate to receive the vaccine. So as we discuss about the cancers, breast cancer and cervical cancer screening, I would like to share that apart from cancer screening, women, they should go for screening for other chronic medical conditions like diabetes, high blood pressure, obesity, high cholesterol. So early detection, early intervention definitely has a better outcome. So I would just like to say that a healthy body holds healthy soul and healthy mind. Take charge of your health and happiness. Wish you all the best.
So Pragati, now can you take over?
So now I hand over to Pragati. Pragati, you are a specialist, our nutritionist. Can you give more insight about the onco-nutrition and anti-aging food sources for women who are having cancers or.
Yes, Pragati, yes.
Yes,
Actually,
absolutely.
Onco-nutrition, food as medicine has come out so much these days, helping so much. And obviously, Dr. Preeti has said anti-aging, that also is much of a requirement. And anti-chronic inflammatory foods. So please mention few so that our viewers get
Yes,
benefited.
absolutely. So whether we call it by the name of anti-cancerous foods or anti-aging or anti-inflammatory, they all are basically the same. More or less, they are the same. See, food and nutrition can help in healing, curing, and managing the side effects of various cancers and the cancer treatments. So, one of the most important benefits of having good dietary habits is that it will reduce the risk of recurrence. If you've already had cancer, if you have gone through cancer treatments, it becomes very important that now you keep a check on your dietary habits. Because it will overall also it will improve your immunity. It will help you maintain an ideal body weight, which is again very crucial. For obese people, we have seen it has become very difficult to cope up with cancer treatments. So focus on your food and nutrition, have well balanced meals so that you're able to cope up and recover from the cancer treatment.
Hmm.
I would say for cancer patients, the number one thing to give up is sugar. It is highly inflammatory, and we need to bring down the inflammation levels from the body. Along with it, you can get rid of any sort of processed foods, packaged foods, fried and refined foods. I would like to share that the most important thing is to supplement the diet with antioxidant rich foods, which is going to neutralize the free radicals in the body, which is again causing oxidative stress, leading to multiple types of cancers.
True.
Let me share with you some anti-cancerous foods
Yeah,
that
sure.
we. So yeah, the various antioxidants which are available in different type of foods are polyphenols, which is nothing but a group of natural compounds. It is found in various fruits and vegetables like apples, cherries, berries, nuts, broccoli, kale, spinaches. In fact, in simple spices like cloves, cinnamon, nutmeg, they are all anti-inflammatory and anti-cancerous. Carotenoids, which is like a pigment that gives foods its color, red, yellow, orange. So include foods like bell peppers, carrots, tomatoes, pumpkin, all of these, and reap the benefits. Flavonoids, another group of compounds found in again all kind of berries, citrus fruits. I would specially mention the flowers, the green tea that we say. So simply grow hibiscus and blue pea flowers in your kitchen garden, in your home garden, and have them instead of having tea and coffee all the time. Resveratrol, it is the red color in the foods, and the sources are red grapes, red berries, red onions. It is found in small quantities of dark chocolate. So you can, have incorporates these foods and increase your antioxidant levels in the body. Then we have sulfur containing compounds, which is found in abundance in garlic. Make sure to have garlic every day in your food. Omega-3 fatty acids. It is shown that omega-3 fatty acids have high anti-cancerous properties. It is found in your akhrot, alsi, and your chia seeds. All these fancy foods these days, like the chia seeds pudding and everything. Include it in your diet and yeah, reap the benefits.
Great. That was so
Yes.
wonderful piece of information, Pragati.
So, Dr. Monica, apart from food, would you want to share with us that how stress can be dealt with doing, there could be various stress management techniques that you would want to share.
Yeah, actually, yeah, I was also about to ask if you can bring the zest of it, and because that's such a big factor, how to manage it very effectively in these times. That is much, much required. So, can you just please go on with the same as Pragati
Yeah.
asked?
Thank you so much, Pragati and Dr. Shweta. Yeah. See, we talk about stress and this stress, do that, stress, do that. Now, in our day-to-day practice, na, how we like face the client. डॉक्टर स्ट्रेस तो होता ही है स्ट्रेस तो सबको ही है this is how people are ignoring this factor especially
Maintaining cause always persists, but then how to deal with it effectively?
स्ट्रेस तो
True.
है स्ट्रेस का तो है ही स्ट्रेस तो but see how stress affect in their different stages na, that is very important like in young girls what happens they are suffering from inferiority complex nowadays because of the social media. This is affecting them. They
True.
look wise. I'm not good. Internally it is developing some kind of inferiority complex. Then they are landed up into substance abuse, which is very common nowadays.
True.
And then intake of certain kind of chemicals and alcohol, and which
Taking
affecting
alcohol.
their dopamine and serotonin level, and it leads to some bipolar kind disorder kind of thing. It ended up like this. It is very dangerous. So, and in case of like married women, they also suffering from that like domestic violence, yeah, sexual abuse at workplace, left in job, taking care of child. These all led up into the stress, bringing up or heightened up the stress level. Now stress hai, but करें क्या stress का? How to cope up with that stress? So most important thing is transparent communication. I always suggest have transparent communication. Whatever you are facing, just talk about it. Ask for help. Go to the counselor. They will definitely help you in what area you need help. So find a good counselor, helper, or whatever. Just have a transparent communication whom you trust. Then after that, they will suggest you some CBT techniques like cognitive behavioral therapy we have relaxation therapies. See, these all are help. Then very beautifully, according to your body, there are exercises. We all talk about exercise, all are very knowledgeable exercise given by the panelists regarding exercise. Every stage of woman's life have specific exercises like Pilates to at certain age. During menopause, you can go for Pilates and strengthening exercises for females, like during menopause, post menopause, etc. And at the same time, like you, once you have a transparent communication, then you go for yoga techniques, talk to your therapist. Then you have a nature walk for 10 to minutes. Please and please do follow your hobbies. At certain stage, what Amelia, I love to dance, I like to draw, but I don't know why I
I'm
nowadays
not
I
able to take out time for that.
but why? I don't know why. This is such a beautiful thing. Live your life at full. So do whatever you love. Love your hobbies. Even we find that who the females who are practicing their hobbies, they are more less too prone to have depression, anxiety, because they're somehow managing their stress level by this. And most important, have a gratitude, have meditations. Now, whatever is your cup of tea, just follow that. That is the main thing. And meditation, etc. Now, there is no requirement of popping up of pills every time. Sometimes talk and good therapies will lead up into a good solution. And
True.
now I would like Dr. Shweta and Dr. Preeti to please enlighten more,
In summing up
uh,
in nutshells,
summing up to our all incredible women out there.
yeah. Just 2 points, 2 or 3 points I would just like to mention to conclude this. One thing, to choose the usual daily products wisely, because we talk about food, that choose your food wisely, as Pragati already said. Also choose your products wisely, because in day to day life there are so many chemicals. As in the starting we talked about the endocrine disrupting chemicals, and there are some estrogen mimics. So we never know that how they are harming over the period of time. So just be aware. Even you choose a toothpaste, even you choose a soap, even body products, or what you say, beauty products, they are loaded with chemicals. And women are smart enough because to take note that what can harm us, what is carcinogenic, what is inflammatory. So there are quite enough resources to see and check all that. We don't need to describe them here. Just for an example, the Teflon coated utensils, and I'm not sure with the name PFO or something like. So choose your products wisely. Even the declogging materials and the fumes. So one thing was this, and second thing, do not ignore the subtle signs your body gives, because body is very reactive and sensitive, mind, body, soul, all three at a level. So do not ignore those signs, because here in this talk, and as per my perception, there are three categories of women. One is very raw and very tough, going through rough and tough life, and very fit in that sense, because they are very raw and out of all these, you know out of all this what is happening these days. Last third categories is of women who are facing all challenges, but they are very aware about their health and know how to take care of it well. But then second category, which is the biggest chunk, and they want to excel in life, have more productivity, but somehow lack to manage the stress, or lack to manage their schedules, and try to struggle. Somehow they do not get timely attention, say medical, in a medical perspective, or even timely attention from their family members also. So this chunk we are mainly focusing on. So that is why I just need to mention this again, that do not ignore subtle signs. Whenever you feel that something is wrong, actively go and incorporate changes, may it be dietary, physical activity, or reach out to someone who can help you, like physicians, counselors. So all that. So that is from my side. And Dr. Preeti, I would like you to conclude now.
Yeah, wonderful insights, holistic perspective of health, physical, mental health, and how can we control it? That is the most important part, which we all know, but we don't practice. So women, especially in our Indian women, they come in the priority list. So please, self-love.
True.
Love yourself. Love yourself. So it is not sinful. If you take care of yourself, invest in yourself first. Take care of your health and happiness. Only then you can.
Lovely. Thanks a lot, Dr.
Family
What a
happy.
wonderful talk it has been. And yes, we are concluding our health talk here. So thank you so much, Dr. Shweta, Dr. Preeti, Dr. Monika. It has been great talking to all you women. We've learned so much.
Thanks a lot to you too, Pragati, for wonderful insights on nutrition.
Yeah, thanks a lot, Pragati.
So I hope the viewers also benefit from it, and they remember that taking care of their physical, mental, emotional health is all very crucial for their overall well-being. Prioritize your health, seek advice, reach out for help, contact your healthcare professionals whenever deemed necessary. And again, thank you so much for joining us today. Wish you all good health and wellness. Finally, to conclude our informative session, another member of our The Vital Healing team, our yoga coach, is sharing some easy everyday asanas which can help tremendously women of all ages to look after themselves.